Good afternoon, everybody. Thank you for joining us today. My name is Nick Ward. I'm the director for the Center of Health and Safety Culture at Montana State University. Our center looks at the role of cultural and social factors in a number of areas of health and safety, how culture affects our decision-making to take risks or be safe. And today we'll be talking about a study that we did in partnership with the Washington Traffic Safety Commission on traffic safety culture and the role of driving under the influence of cannabis and alcohol. The issue of cannabis and driving is of interest to a number of jurisdictions, especially as laws regarding recreational and medical use of cannabis changes. And in this project, we look at what the traffic safety culture components are that may predispose people to decide to drive under the influence of both cannabis and alcohol. So in this study, which will be presented to us by our center's principal scientist, Jay Otto, we'll look at the role of traffic safety culture and its influence on the decision to drive under the influence of both cannabis and alcohol. Jay, over to you.
So great. Thank you very much. My name is Jay Otto, as Nick said, and I just want to go through a couple of things just to make sure folks are comfortable with the interface. If for any reason you should be, hopefully you won't, but sometimes WebEx drops folks, just you can find the telephone icon, most likely at the bottom there. You might have to hover over it, click on that. You can have it call you or you call back in, but hopefully you won't be dropped, but if you are, just reconnect on the audio. You can use the chat box. You have an access to a chat box that should be on a panel, maybe on the right-hand side. So you can feel free to send in either with the chat box or the Q&A box to send questions. We'll keep the audio muted on folks just to make the recording a little bit better. But we'll keep an eye on those, and we'll definitely have some time at the end to be able to try to address those. So feel free to send those in at any time. If I can, I'll try to maybe address it as I see it, but we'll have a chance at the end. So that's the best way to share things as we're going through. So our agenda for this webinar is do a very brief overview of the center and a little bit of our approach. I think that helps set up the understanding of how we design the study. Then we're going to go through the Washington State's, the DUICA study, and then we'll have some chance for questions and comments. So as Nick mentioned, we are a center that looks at the intersection of culture, shared values and beliefs, and how that influences various behaviors that impact health and safety. We're very interdisciplinary. We also think it's critically important to bring the findings out to community where the work is occurring. All of our research is sponsored by agencies who are wanting to move the needle on various topics. A lot of our work is sponsored by states. We have some federal projects and some community level projects. But it's all very applied research. We focus principally on three core areas: traffic safety. Historically, we've done a lot of work with the misuse of substances and still seek to work on that. And we're starting to do more work around violence, child maltreatment, child well-being, interpersonal violence. And I think many of you all know these behaviors are interrelated. They also have collectively a tremendous public health burden. And so unintentional injuries, the leading cause of years of potential life lost before age 65. We've certainly heard a lot about overdoses, but obviously the misuse of substances also contributes to traffic safety issues. And of course, violence comes into that mix. And we also are learning more about how adverse childhood experiences can be a contributing factor later on to the misuse of substances and traffic safety issues. So, but it's interesting at the federal level, these issues are handled very differently. And at the community level, I think community level folks know that they overlap. So it's in our research is how do we look at this and seek to find a process that maybe transcends the issue that allows for communities and states to address this in a holistic fashion. So we're not going to go into any real depth on this, but we do have a framework that guides how we do our work. And so that there's steps that we go through. Those are the blue sectors on the left-hand side. There's a context, the social ecology that we work on. We work on developing skills around leadership, communication, and integration. But it's towards this outcome in the green arrow And we really do take an appreciative approach, which is why we put our outputs in an upward facing green arrow. So if we sort of take the approach of Stephen Covey, begin with the end in mind, at the top of that arrow, we tend to always put improving health and safety. And we think it's important to set that frame in our work at understanding, let's say, the interactions of driving under the influence of alcohol and cannabis. It's all towards that goal of improving health and safety. We're going to do that by looking at a variety of protective behaviors and risky behaviors where we're seeking to increase protection and decrease risk. And we're really thinking about that across the social ecology or the social environment. Even when we think about behaviors with drivers, it's not enough just to focus on driver behaviors, but we really want to look at behaviors at all layers of the social environment and how those different behaviors start to influence driver behaviors. And we're going to seek to change those behaviors with that bottom section by improving what we call cultural factors or shared values and beliefs across the social ecology that start to influence those protective behaviors and decreasing the risky behaviors. So we use this as our definition of traffic safety culture. There are many different definitions of culture, but this is a definition that we use because we can operationalize this and we can measure it, we can grow it, and we can assess its impact on outcomes. And so we view traffic safety culture as the shared belief system, which would include values and a variety of other beliefs, of a group of people which influences road user behaviors and stakeholder actions that impact traffic safety. So it's not enough just to look at road user behaviors, but also looking at stakeholder actions. And in this study, we're going to particularly looking at shared belief system around driving after using alcohol and cannabis. And we are looking at it in a context of drivers, but this is just one slice of the work that we would do to address this. Now, when you start talking about belief systems, there are obviously a lot of different beliefs that we can hold about any kind of behavior. And a significant part of our work is to figure out which beliefs are most salient to predicting behavior. So this is a very simplified behavioral model, but it's recognizing that intentional behavior, a behavior like driving after using substances, is something that is predicated by certain beliefs. And there would be a willingness and intention potentially to engage in that behavior. And that willingness and intention is going to be influenced by a variety of beliefs about that behavior, as well as some values and assumptions about the behavior and about the broader context. And so this is obviously a very simplified behavioral model. This is the behavioral model that we use to actually design the survey, and that's what I'll be walking through today. So we use this as a mechanism to develop constructs that we then seek to measure and assess their relationship with willingness and intention, and then how much is willingness and intention associated with risky or protective behaviors. And in this context, we're working totally from a self-report setup, but that's still very helpful and gives us some very important insights. We would seek in other projects where we can also include observational data. But in this case, it is all around self-report. So we're looking at self-report past behavior and then self-reported alignment with various beliefs. So we'll walk through the different components of this behavioral model as we assess them on this behavior and see how they're what we learned. This simplified behavioral model, while very simplified, is still very powerful in that it helps us recognize that these values, assumptions, and beliefs are where we're going to focus our work in terms of developing interventions and other mechanisms to create change. Clearly, our ultimate goal is to change behavior. Our ultimate goal is to improve health and safety. We know that health and safety is not going to improve if behavior does not change. So yes, we must seek behavior change, and our strategy to promote behavior change is to understand the values and assumptions and beliefs that are leading to risky behaviors or inhibiting protective behaviors. And then how do we start to create interventions or resources or tools to change certain of those assumptions, to align with certain values, and to shift certain beliefs to promote the behaviors we want to promote and decrease the risky behaviors. So that's very quickly a little bit of the context of our approach, and I think it helps understand this project. So as Nick mentioned, this is a project that was sponsored by the Washington Traffic Safety Commission as a part of their Target Zero work. So we're gonna do a little bit of context to set that up. They were very concerned about impaired driving. Alcohol and drug impaired driving is the leading contributing factor in Washington fatal crashes. So this was at their top of their list. So they wanted to understand this more and wanted to understand more this complex issue around alcohol and cannabis use. The general context in Washington is that cannabis use is increasing. So between 2008 to 2017, past year cannabis use by adults age 18 and older increased by 85%. And of course, this is in the context of legalization. First, it was legalization of medical cannabis, and then moving to recreational cannabis. So this broader context is that cannabis use by adults is increasing. We're also seeing from other studies that weekend nighttime drivers testing positive for THC increased by 50% from 2007 to 2014. Now, we know understanding driving under the influence is complex, and THC in the bloodstream is a partial indicator, but it's not the greatest indicator. There are challenges there. But nonetheless, when we look at this, we know that drivers, at least in some period in their past, have consumed cannabis, and we're seeing increases, significant growth there from 2007 to 2014. We also know that by self-report on some of those roadside surveys, in June of 2014, it was about 11% of weekend nighttime drivers reported they had driven within 2 hours of using cannabis. So this is self-report, at least once in the past 12 months. So by self-report, they're driving within 2 hours. And in 2016, polydrug drivers, which included alcohol, were significantly involved in fatal crashes. There were more than twice the number of alcohol-only drivers and more than 5 times the number of cannabis-only drivers. So we're definitely seeing this multi-drug use, and alcohol and cannabis are two of the leading substances there. So this is just setting up a little bit of the context for the study. We also know from broad work that's going on that driving under the influence of cannabis does increase crash risk. I think we're sort of behind the curve in getting some of that data out, but there are multiple studies now that are starting to show that it's increasing crash risk. We understand that it's probably at a lower level of crash risk than we might see with alcohol, but the evidence is really coming in, although it's complex in terms of measuring it and assessing it, because THC in the bloodstream may be a poor indicator. So that set it up where the Washington Traffic Safety Commission engaged us to try to understand more about some of the belief systems behind this behavior. So we wanted to really look at the shared values, attitudes, and beliefs and behaviors. We defined DUICA, or driving under the influence of cannabis and alcohol, as driving within 2 hours of consuming cannabis and alcohol. We'll talk a little bit more on the next slide about that decision, but that was just a metric that we sought to establish as we were going to define it as driving within 2 hours. We developed a survey. We did a lot of pilot testing of the survey with convenience samples, and made modifications of the survey just to make it more predictive and to hone in on what values, beliefs we wanted to focus on. We then engaged with the National Opinion Research Center, also known as NORC, which is affiliated with the University of Chicago, to use their AmeriSpeaks panel. So they have a standing panel that's recruited, that's a random sample of households that can then participate in surveys. We then augmented that with additional individuals recruited online, and they did weighting of the various samples to align them with the general population. So in the end, the sample was 870 adults, age 18 to 65, who were living in Washington, and the survey was done in the spring of 2018, so almost a year ago. Now, let's talk a little bit about why we chose within 2 hours of consuming cannabis and alcohol. There have been different measures, especially around cannabis. Some folks have used 3 hours. Some folks have used 4 hours. There was some previous work done in Washington that had used 2 hours. We had actually done some previous work where we had used 4 hours. We elected to use 2 hours because that has been used with alcohol in the past. It is also used currently with cannabis on the National Survey on Drug Use and Health. The NSDUH uses a 2-hour window. And there's a National Survey of Drinking and Driving Attitudes and Behaviors, which use 2 hours with alcohol. We also felt it was a little bit better on the survey to use the same window, 2 hours, with each of the drugs, so we didn't get confusion there. We want to make very clear that a 2-hour window does not create safety. So if one is driving after 2 hours, that does not imply that the individual is safe to drive. And cannabis is particularly complex because of edibles. So edibles can seriously delay ingestion of cannabis into the bloodstream and the system. And so, yeah, we recognize 2 hours is by no means a magic number, but it was a number that allowed us to compare with other surveys and consistency within. So we want to be very cautious that 2 hours is not a safety level. So some of the things we started to ascertain from the survey was most adults are concerned about traffic safety and have strong protective beliefs. So when we look from a broad cultural perspective, that was a place where we always begin. Most are moderately or more concerned about safety on roads and highways. About 74% agree the only acceptable number of deaths and serious injuries on roadways should be 0. So that's good just in terms of that alignment with a target 0 vision. We'd like to get that up higher and seek to understand what that 26% who doesn't agree with that, sort of where they are. But that's a good place to begin. Most, 9 out of 10, agree that it's the responsibility of the driver to comply with the laws of our roads. So that's a good place to start. We're concerned about the 8% who don't agree. But again, we're looking at some broad brushstrokes to begin. About 2/3 agree that impairment begins with the first sip of alcohol. That's, I think, something we're also exploring as we look at impairment, this notion that it's not a yes or no, but it's levels of impairment, and then impairment at some form begins with first ingestion. And we can see that agreement is a little bit higher, close to just over 3/4, that impairment begins as soon as you start consuming cannabis. So this just established some basic beliefs, but that overall, we also from a cultural standpoint recognize as a positive culture that we can build on. We definitely have room to improve these, but it does set this broad context that we can start from. Now, when we looked at self-reported 12-month driving behaviors, we had about 22% reporting driving under the influence, driving within 2 hours of consuming alcohol. That meant 78% don't. That's pretty typical as to what we'd see across other states based on some other those other national surveys. We are worried about that 22%. I think, as a nation, we want to try to drive that down. Other countries are started to really move towards you just don't drive after consuming alcohol. But we have work to do in this country on that. But again, we've got a strong culture there to begin with. 85% don't drive within 2 hours of consuming cannabis. And then when we looked at the combined behavior, we had 91% don't drive within 2 hours of consuming cannabis and alcohol. So we had about 9% who were engaging in that. That was somewhat similar to what we saw with that roadside self-report of 11%. So we're seeing some consistency there between that non-representative sample, which was on a weekend night, just drivers, to this broader population sample. Similar levels, that had 11%, this had 9%, so pretty consistent. 9% might seem like a small number, but from a public health standpoint, engaging in a very risky behavior. So we're very concerned from a public health standpoint. From a cultural standpoint, most people are not doing this, but from a public health standpoint, 9% is way too high. So then what we did is collected constructs for each component of the behavioral model. We're going to walk through those. What we're going to share with you are graphs that show the averages, the means, of 3 different groups. So the gray box is the average for those who reported no cannabis use in the past 12 months. The blue box is those who reported cannabis use in the past 12 months, but never driving under the influence of cannabis and alcohol. And the red stripes are individuals who obviously have used cannabis and alcohol in the past 12 months and reported some level of driving within 2 hours of consuming both. And all of the scales range from about 1 to 7. They'll be labeled specifically as we get into the different constructs, but you can just start to see, based on the different constructs, how these different 3 groups spread out. The width of the box is a 95% confidence interval, so you can start to see some statistical significance in terms of differences. So let's walk through and look at some of these. When we look at their attitude, attitude are one type of beliefs that can influence willingness and intention. We see their attitudes are significantly different. The top row is the average attitude across 4 different components of that attitude. And you can see that even people who drive under the influence of cannabis and alcohol, on average, have a negative attitude. That is, they're left of the center line. The center line here is neutral. On the left is a negative attitude. More to the left is a stronger negative attitude. To the right is more of a positive attitude. All the way to the far right is a stronger positive attitude. So even those who do it have an overall average negative attitude, but you can see relative to the others, their attitude is much more positive. And what we found was that individuals who do have a positive attitude were significantly more likely to engage in this behavior than those folks who don't have a negative attitude. And so that was very important. They're about twice as likely, if you have a positive attitude, to engage in DUICA relative to those with a negative attitude. You can see when we broke that into some individual components, sort of its utility, its sense of danger. Those who engaged in it are less likely to think it is dangerous, more likely to think it's pleasant, and more likely to think of it as calming. When we dug deeper into beliefs that start to inform attitudes, we looked at 3 beliefs that have positive expectancies for driving under the influence of cannabis, alcohol, and 3 beliefs that had negative expectancies. So the first one is sort of, I'd be more aware of the driving environment. You can see that individuals who drive under the influence of cannabis and alcohol were more likely to agree with that. I mean, on average, they're neutral. But relative to the other folks, they're more likely. They're on average, they're slightly disagreeing, but they're more in agreement to that than those other folks who don't do that. They're more likely to agree with that sense of feeling calmer, and more likely to have a sense that they'd be better able to notice and respond to events. Now, again, we're not claiming that these beliefs are accurate. This is just the beliefs that they hold. So that's important to recognize, because part of the work may be correcting false beliefs. You may feel like you're better able to respond, but you may actually not be responding better. Individuals who regularly or who do DUICA at least once in the past year perceive that they were they had lower levels of agreement that they'd be likely to get arrested, that their reaction time would be slower, and that they'd have a higher crash risk. So again, these are the beliefs that they hold, and I think all of the beliefs on this graph are opportunities that we want to seek to shift to start to influence their attitudes. So this was important for us to be able to see how the different beliefs were starting to align with the attitude, the overall attitude. We looked at 2 forms of perceived norms. We looked at perceived injunctive norms. These are beliefs about what one should or should not do, what's acceptable. We also looked at perceived descriptive norms. We'll look at that next. But under perceived injunctive norms, we asked them how acceptable or unacceptable is driving within 2 hours of consuming alcohol and cannabis, and how did they perceive others would rate the acceptance. So we began with them, sort of you, and you can see that people who do it are more likely to perceive it as acceptable. On average, they're just above neutral, but they're much more to the right than the other two folks who viewed it as extremely unacceptable, or groups of folks. We also asked sort of how would they perceive their friends would see it, and a similar pattern there. Their family, even their employer, most people who drink alcohol, most people who use marijuana or cannabis, and most people in Washington State. Now, I think it is valuable to notice, overall, when we look at the response for you, the vast majority of people are included in the gray and the blue box. So overwhelmingly, most people agree this behavior is unacceptable. But now when we go down here to the bottom row, even people who perceive it as unacceptable or who don't do it, they're not sure that everybody else is perceiving it as unacceptable. So there's definitely some opportunities to correct those gaps in perceptions, those misperceptions, that overwhelmingly people recognize this behavior as unacceptable. But there are lots of misperceptions that are going on. So this is another opportunity to influence, and certainly perceived injunctive norms were important. Those people who believe that driving under the influence of cannabis and alcohol is acceptable are more than 4.5 times as likely to engage in that behavior compared to people who perceive it as unacceptable. So in this behavior, sort of acceptance of it was a significant predictor of their willingness and intention to engage in the behavior. We also looked at their perceived descriptive norms. This is what do I think everybody else is doing? What is typical behavior? We also know from the research this can be a significant influence. So we asked it about several different referent groups. We asked about it like most people like you, and you can see the perceptions are off by everybody. So even people in the gray and the blue box are perceiving that a lot of other people are engaging in this behavior, when in fact, overwhelmingly, 91% of the people are never engaging in this behavior. So we've got some misperceptions there, but those who are engaging in the behavior, their misperceptions are even greater. They have misperceptions about people with whom they may work. We asked this in terms of what they think elected officials are doing, and also just what most adults are doing. So a lot of misperceptions existing here, an opportunity to correct these misperceptions. These misperceptions were also connected to stronger sense of intention or willingness to do it. People who perceive that most people DUICA frequently were 2.5 times as likely to engage in that behavior relative to people who perceive most people do it infrequently. We also wanted to explore their sense of control about this. Is this something they feel they are in control of or less likely to be in control of? So we examined some control beliefs. So you can see one thing that just comes up is, are you in a setting where this is likely to happen? And of course, as expected, they're more likely to be in a setting where they've been drinking and cannabis is available, those folks who are doing it. So that makes sense. But what was interesting is they're much more likely to have this sense of feeling anxious after drinking and then using cannabis to calm down. So clearly the substance may make them feel calmer, but it doesn't make them better at driving. So that becomes an important perception that we want to address, a belief, but that was clearly coming out with that group. Similarly, that notion that they're feeling too impaired after drinking and then using cannabis to sober up. So again, cannabis does not sober you up, but if you feel like it does, you might be empowered to engage in a very risky behavior that you otherwise wouldn't. So we want to really recognize that, and these are some important beliefs that we may seek to change through intervention. We could also look at their willingness to ask somebody for help so you don't need to drive, as well as potentially using a ride service. So these were 5 control beliefs that we looked at, but very important to recognize that this very different sense of control around these 2 particular feeling anxious and using cannabis to calm down, and feeling too impaired to drive and using cannabis to sober up. We also looked and used a general value scale to look at 10 different values, and then how did folks rate these values in these different groups. And as you can see, overall, on 9 of the different values, folks were pretty similar. However, on this issue of power, it was quite different. And this was startling. We've used this value scale on a number of our different work, and usually we don't see this large of a difference. We actually, in parallel with this sample, which was a representative sample, we ran a similar survey, the exact same survey, with a bias sample. We collected a large sample, a convenience sample online, and we recruited people who had used cannabis in the past 30 days because we really wanted to see what folks who regularly use cannabis were thinking and doing. And so that's a very subset, but we got a very large sample from that as well. And their pattern of values aligned very similar to this sample. And that is those folks who were engaging in driving after consuming both substances had a very different valuation around power. And power was more, the further you move out, the stronger you value that dimension. And this, I think, is important because as we think about intervening and we think about designing communications and different tools, we're going to have to be mindful that power is stronger here, and be careful in terms of messaging and different things that may trigger a pushback from power, or perhaps these psychological reactance to power, or things like that. And we may want to focus on other beliefs that folks shared in terms of being, helpfulness or enjoyment in life or self-direction. But there were very strong differences in this element of power. We also looked at some basic assumptions around just substances and traffic safety. So we already talked a little bit about that one, sort of their agreement with that statement that impairment begins with the first sip of alcohol. And you can see they have similar beliefs about that as folks who don't drive under the influence of cannabis, that they sort of agree with that, but they're at a lower level than the folks who aren't using cannabis. Impairment begins as soon as you start consuming cannabis. Overall, folks are agreeing with that, but we have certainly it's a low level of agreement. We have a lot of room to grow that. This was interesting in that the legalization of cannabis implied that it is safe to drive under the influence of cannabis. And that was very different amongst the 3 groups. And those folks who were engaging in the behavior were more likely to agree with that relative to the folks who don't engage in that behavior. And a lower sense of responsibility of the driver to comply with the laws of our roads. So that sense of maybe not feeling like I have to comply with those roads, maybe that's tied into that strong sense of power of pushing back against some of those laws, or that sense of, well, I do it because I'm actually driving better or their perception of driving better. So it was interesting just to see how some of these broader assumptions started to relate with some of the behaviors as well. We also asked, and we're not going to go through all those results just because of time, but we also asked some questions about their willingness to intervene. One of the things we want to look at is how do we promote proactive traffic safety? How do we really get folks to act with themselves and with others to proactively be safer on the roads, not just always react, but proact. And so it was interesting. We just asked everybody, have you been in a situation to intervene with somebody in the past 12 months who's perhaps had too much alcohol or cannabis and shouldn't be driving? And about 40% said yes, they had been in that situation. So that's a huge number of folks who find themselves in these circumstances where they could intervene. So a tremendous opportunity. And we know that often alcohol or cannabis consumption can occur in social settings. So it makes sense, but that's a large chunk of the, this is amongst all respondents. So 40% of all respondents had been at least once in the past 12 months in that situation. That's a huge opportunity. And if we could get those folks to intervene, that's a great opportunity to maybe reduce risky behaviors. Then amongst those who had been in a situation, so just this greenish sector, we asked them, how often did you intervene? And about 20% said rarely or never. About 53% said about half the time, and about a quarter said usually or always. So we were then also able to explore, what were the belief systems that were seeking to promote that bystander intervention. And these were some of the ways that people were actually choosing to intervene. So we can see, arranging a ride for the person was the most prevalent, and that makes sense. Although that can be tricky in rural settings, like in urban settings, this can be easier if I can use a ride share or some other resource like that. But in rural settings, this can be a challenge. So that might be something we have to look at in terms of rural settings. How do we create more mechanisms to arrange rides? Engaging somebody else for help is a good, first step. That might not be the last step, but it's a good first step, and a lot of folks are doing that. Arranging for the person to stay, so that's a safe opportunity. Giving the person a ride, some folks are doing that. Waiting with the person until they sober up, some folks are doing that. And yes, recognizing that in certain cases we need to call law enforcement. That's not an option, just all the time. But if somebody is actually getting in their vehicle and leaving, that might be the most appropriate option. Having that person arrested is better than having them kill themselves or kill somebody else. But clearly that's much lower on the scale. But it was interesting just for us to learn how people are intervening. We also, I won't show it here, but then we also collected some of those basic beliefs across the behavioral model to understand what were some of the beliefs that were linked with engagement or willingness to intervene. And what we found was similar to what we found in other areas of our work, which is that it's largely around control beliefs. People feel like it's the right thing to do, it's a good thing to do, they should do it, but they're not sure, they're not comfortable in doing it. So that's just going back to that notion that we need to build people's strength and comfort in being able to do it. Now, with the Washington Traffic Safety Commission, we wanted to distill these results down in terms of what people can do, and really bring it down to the individual level, sort of what can you do? So first thing was just starting to share and discuss these results. When we think about the work of growing positive traffic safety culture, part of that work is just overcoming our misperceptions about what is our current culture. And as we saw in this survey, people had misperceptions about what other people are doing and what other people believe. So we need to get out there first and correct that DUICA is not safe. Some folks are believing that it's safe. More and more research is showing that driving under the influence of cannabis is not safe. Combining cannabis and alcohol is not safe. Most people get that driving under the influence of alcohol is not safe, but we still can work on all of that. Most people absolutely believe that this behavior is unacceptable. There are misperceptions about that. Some people are not thinking that everybody else is thinking it's unacceptable, but overwhelmingly people believe it's unacceptable. And most people don't do this. Both of these are drastically misperceived. And we just need to get out there, hey, folks are not doing this and they believe it's unacceptable. And that using cannabis after drinking does not make it safer to drive. So even though you may feel calmer, you may feel like you're better to drive, that's not true. Yes, you may feel that way, but you're not safer to drive. You're at greater risk. We also want to look at ways that certainly stakeholders, and this could be stakeholders who run programs, drivers education, all sorts of different stakeholders, how they could integrate accurate information into their existing programs and strategies and communications. So obviously there's a huge amount of communication that goes on in traffic safety. All of those communications are an opportunity to infuse this information. So just looking at those opportunities and then starting to infuse this information in there. We can also seek to grow bystander engagement. So starting to think about how do we bolster the confidence and comfort of people to take appropriate steps. A lot of folks are in an opportunity where they're recognizing risky situations, and many are taking steps. So we want to grow that sense of doing something and get those steps to be taken more consistently and just by more folks. So they can do things like, arranging or providing a ride, arranging for the person to stay, engaging somebody else to help, or if need be, being prepared to call 911. And so these are things that can be integrated into existing programs and strategies. We want to be very careful when we talk about bystander engagement to also say what is not acceptable. It's not acceptable to promote disabling vehicles. That's never a good option. It's not acceptable to allow impaired people to walk. That is very dangerous. So drink walking or drunk walking, people walking into roadways, people in rural areas walking off of roadways and freezing to death. So walking is not an acceptable solution, nor is the use of physical intervention. But we can promote safe strategies, like we mentioned, arranging or providing a ride, having the person stay where they are, or engaging others to help. And that could include 911 if the person chooses to drive. But ultimately, we want people to really plan and think about this ahead of time to avoid bystander engagement, but clearly it's going to happen, and it's good if we can empower bystanders to take action. Okay, what I'd like to do is share very quickly a video. Kelly Hall, who works with us, is going to share a video in a moment. And this is an example of a video piece that Washington Traffic Safety created. It's a combination of two leaders. One of the leaders is the leader of HempFest. The other is the director of the Washington Traffic Safety Commission. And I think it's a great example of two leaders coming together, sitting together, talking about traffic safety. And you'll hear them starting to address some of these issues, some of these beliefs very intentionally in the piece as it's coming forth. So go ahead and play that, Kelly.
Cannabis use is legal in Washington, so you can't get a DUI for driving high.
Wrong.
I drive better when I'm a little high.
Yeah, that's just not true. Driving is the most dangerous activity that most people engage in on a daily basis. It doesn't matter what you're on if you're impaired, and if you get in a car crash, you're just as dead, and if you get arrested, you're just as arrested.
Driving under the influence of cannabis, it doubles your crash risk. And, you know, we like to call them crashes because we don't use the word accident because we see that crashes are absolutely 100% preventable.
If I've been drinking, weed helps me sober up to drive safe.
The mixture of the two is a deadly combination.
You know, this is one of my pet peeves. Driving on any substance doesn't make you a better driver. That's just crazy.
Cannabis activists and government officials don't agree on anything.
We agree that you shouldn't drive impaired at any time.
Just don't consume and drive.
The alternative to driving impaired is to have a plan and take an alternative method of transportation.
And that's why we're here together to address those things so that we can see a reduction in fatal crashes and being able to save lives.
What else do you agree on?
Jerry Garcia ties.
Yes, yes.
It's an example of just starting to put some of that information out. You can see very intentionally designed to do it in a way that is not authoritative or threatening, but done in a way to really promote folks listening to it, hearing it, and thinking about those beliefs and starting to address those important beliefs in terms of using cannabis by itself or after other substances. Even though you may feel calmer or more attentive, you're really not. So we've presented a fair amount of information now. I think what we want to do is pause. That's all the content that we had. And we can look at the chats to start to see any of the questions or things that comes through. So good. The study size was about 870 participants. The demographics were representative of the general population. So it mirrored the population of Washington, which is, I don't have the exact demographics in front of me, but we were representative of different ages, genders, ethnicities that mirrors what the census shows. Now there are limitations. We only did the survey in English. The census does show that the vast majority of residents in Washington State are English speaking, but it definitely, if you were non-English speaking, that's that's a bias. And so, but overall, the AmeriSpeaks design is to get a representative sample. Yes, so we were able to run some things by age and look at some different components. Let me grab that on some of my notes here. In general, as somewhat expected, males were significantly more likely to engage in DUICA than females, about 3 times. DUICA did decrease with age. So we're definitely seeing it more with younger folks than older folks. Education attainment really did not have a statistically significant association with DUICA behavior. We saw slightly more engagement in the behavior with folks living on the eastern part of the state than living on the western part of the state. It wasn't huge. And that could be a little bit also because eastern tends to be a little bit more rural. So there may be not as many options for rideshare or public transportation. We asked self-report, sort of, are you a chronic user of cannabis? We did not provide a definition of that. We allowed them to sort of self-define that. But chronic users of cannabis were no more likely to DUICA than non-chronic users. We did not see any effect from whether somebody indicated they were sort of primarily a medical user or a recreational user or both. That didn't really influence DUICA. And we also asked sort of some reasons you might use cannabis. Was it for sort of physical, mind, emotional, or spiritual benefit? And we did not see any association with DUICA with any of those specific benefits. So there is a key findings report that's available that goes into and provides some more of that depth. And so that's something, but those were some of the associations with demographics that we looked at. So that's a good question. I don't know the answer to that question either at the federal level or at the state level. We might be able to have send something out at the end with a follow-up in terms of Washington State. I think Washington State is engaged in a variety of different communication efforts, and this issue of impaired driving, I think, is one of the things at the top of their list. And they're going to start to broaden that conversation of impaired driving to absolutely include alcohol, cannabis, and potentially other drugs. But I don't know the exact answer to that question. Good. They were from across the state, so it was a representative household survey, so it would be geographically representative across the entire state. We have not studied that directly. I think so. I'd have to go back and look. You can clearly see a correlation between ACEs and misuse of substances, and then I think you can clearly see an association between misuse of substances and impaired driving, and therefore crashes. So I think it's through that pathway of misuse of substances. Could be one. There could be other pathways. We have not studied that, and I'm not sure of the research that's out there looking at that. There's been a lot of work on ACEs, so I wouldn't be surprised if somebody's looked at ACEs and traffic risky behavior, but we have not, and we haven't done that research either. Good question. So we did ask and have a sense around urban, suburban, and rural. We did not ask anything about trip distances. So we asked in terms of sort of frequency of how many times did they estimate over the past 12 months they had sort of engaged in that behavior. Sort of, was it a rare event or was it something, the other extreme was daily. But we did not look at all at trip distances. Good. We did not explore whether people agree that it's achievable or not. That's a very interesting question. But the primary focus of this obviously was DUICA, and we were already at a really long length of survey. So what we just asked was sort of their level of agreement with that being a goal. And we do ask that in 2 ways. We ask sort of in general, do you think the goal is 0? And then we ask in the context of their family and friends, but we don't ask as to whether they think it's achievable. So I think you could definitely get access to the key findings report and use those results to share. I think what we we always seek is sort of the same sort of consideration is, just cite it as to where it came from, so folks know where it's coming from. But yeah, I think part of absolutely the work we need to do to improve traffic safety is to take information and bring it out broadly so that folks start to explore this. This was done, in one state. We're going to be at the center. We're in conversation with NHTSA about some additional exploration of looking at this. And this issue is certainly of driving under the influence of cannabis even broader. But it's interesting in terms of potentially replicating this in other states or looking at a national frame. Obviously, looking at states where it's legalized, you've got more folks who are engaging in it, in using cannabis. But certainly, I think we need to foster more and more conversation around this as more and more states are considering and have legalized cannabis. Oh, good. So ACEs are adverse childhood experiences. There are typically 7 or 9 specific adverse childhood experiences that are used in instruments. It was a study that was done, probably over 20 years ago, a retroactive study where they examined histories of the full medical history of adults and then sought to measure their engagement with various adverse childhood experiences, and then looked at that association with later on lifetime health. And adverse childhood experiences could be like having your parents go through a divorce when you were a child, having one or more family members who was experiencing a substance use disorder, having ever been a victim of childhood maltreatment. I can't recall all 7 or 9. But you can also look at the CDC has an extensive area on adverse childhood experiences. So if you Google CDC and adverse childhood experiences, they'll have a whole section on it. And they've developed some surveys, and many states have started to measure adverse childhood experiences in their behavioral risk factor surveillance surveys, their BRFIS. So your state may have done the ACEs panel, and then you could assess the prevalence of ACEs in your own state and look at its association with risky driving behaviors or other things. Well, certainly, I think their beliefs as being significantly different from the others is very important, and it's the opportunity. I think if you go back to that slide where we had that very simplified behavioral model and that recognition that beliefs influence our choices in terms of behaviors, seeing those very different beliefs, shared beliefs by that group who is engaging in that behavior is a tremendous opportunity, because now we can see how they are seeing things differently. And that's an opportunity through intervention and other mechanisms to start to shift those beliefs and help them realize, even though you may feel like you're driving better under the influence of cannabis, you're really not. And that's a misperception. And so starting to shift that belief. So I think all those opportunities where the red group was different than the other group are all those situations where the red group was different than the other groups are opportunities for us to potentially shift those beliefs and thereby shift the behaviors. Yeah, so that comes out, we can go back to those slides. That comes out in a couple of those studies. I think it's mentioned in the study that in this, the first reference here is from the National Academies of Science. It was really the National Institute of Medicine. And they referenced a large number of studies, and those studies will start to peel out the differences between crash risk from cannabis use and crash risk from alcohol. I think it also comes up in the meta-analysis that was done, as well as some of these others around self-report. Nick Ward, who introduced this, is as a part of another project. We're working on a distillation of a lot of the research around driving under the influence of cannabis. And so that report's going to be coming out in a couple of months and will be available through the Traffic Safety Culture Pooled Fund. But that'll also bring together a lot of different research that is ongoing on this. But there are a number of sources. There's obviously a lot of research out there in terms of the crash risk around alcohol. And then a lot of these studies that are looking at the crash risk of cannabis also look at it in alignment or in comparison to crash risk of alcohol. So I think all three of these actually talk about crash risk of alcohol as well.
That's great, Jay. Our hour's up, so I think we'll stop there. I appreciate all the questions, great questions. If you have other questions you want to ask or would like to get some more information, please feel free to contact our center. We'll be sending out an email shortly when the webinar is recorded and available online, and that might give you a chance to reflect more on what we presented today and have some additional questions for us. But please feel free to contact us if you have any further questions or suggestions for additional research questions that might be worth exploring moving forward. With that, everybody have a safe evening. Drive home safely if you are, and we look forward to speaking to you again. Thank you.